Imagine you are a nurse making a critical decision for your patient's care, perhaps choosing the best wound dressing or deciding on an intervention to prevent falls. How do you ensure your choice is the absolute best one, not just based on tradition or a hunch? In nursing, evidence-based practice, or EBP, relies on a variety of evidence types to guide clinical decisions, patient preferences, and clinical expertise. The most robust evidence often comes from high-quality research studies, but other forms of information are also crucial for comprehensive care. The core mechanism behind EBP is the concept of an evidence hierarchy, which ranks different study designs based on their potential to minimize bias and provide reliable results. At the top are systematic reviews and meta-analyses, which synthesize findings from multiple randomized controlled trials. These types of evidence offer the strongest recommendations because they pool data and reduce the risk of chance findings or individual study flaws. Lower down the hierarchy are individual randomized controlled trials, cohort studies, case control studies, and descriptive studies, each offering progressively less certainty but still providing valuable insights. To effectively use this evidence, nurses integrate findings from research with their own clinical expertise and the unique values and preferences of their patients. For instance, a nurse might review a systematic review on pain management techniques but then consider a patient's personal history with certain medications or their cultural beliefs about pain relief. This integration allows for tailored care that respects both scientific rigor and individual needs. It is not just about finding the best study, but applying its principles wisely. Interestingly, the hierarchy of evidence is not always rigid. Sometimes, for very rare conditions or specific situations, lower levels of evidence, such as expert opinion or qualitative studies, can be invaluable when higher-level research is simply unavailable. This nuanced approach recognizes that patient care is complex and cannot always wait for a perfect randomized controlled trial. These less formal sources are particularly important for understanding the patient experience and informing ethical decision-making. Ultimately, understanding the different types and hierarchy of evidence empowers nurses to critically appraise information, make informed clinical judgments, and advocate for the best possible patient outcomes. By continually seeking out and evaluating evidence, you contribute to a culture of excellence and ensure that patient care is always grounded in the most current and effective practices.